Quick test. Could you tell your GP exactly where it hurts, your vulva or your vagina? Or would you just say down there? Many of us are confused about what's in this part of our body. So here's the one line that fixes half of the confusion. Vulva, outside, vagina, inside. Hi, I'm Dr. Sylvia, an NHS GP and women's health doctor. In the next few minutes, I'll give you a clear outer map, right from the clitoris, your inner and outer lips, your bladder opening and vaginal opening, so you can describe exactly where your symptoms are without guessing down there. If something hurts, itches, or looks different, saying down there is just too big a map to negotiate. A sore on the outer skin of your vulva is not the same as having a pain inside the vaginal canal. Having the right words don't replace a proper assessment, but they can help your clinician start in the right place to treat you and get you the treatment faster. And in just a second, I'll show you exactly where the outer and inner lips and clitoris sit within this outer map. The vulva is everything you can see on the outside in between the legs. From the soft pad of skin over the pubic bone and the pubic hair and back almost towards the anus and the back passage. It includes the openings you can see from the outside. The vagina is the inside muscular canal, and it's the passage that connects your outer opening to the womb. So it's not the whole of down there, it's the internal part. So don't forget the easy line again. Outside vulva, inside vagina. So let's start at the front where the pubic hair is, and then we go lower. 1, the clitoris. At the front tip of the vulva is the clitoris. It's a small, highly sensitive structure. What you can usually see is the head and a little fold of skin over it like a hood. You can tell your doctor that it's the front bit underneath your hair. That will make it clear enough what you're referring to. 2, the outer lips. These are the fuller folds on the outside of the vulva. In clinic, we call them the labia majora, which just means the large outer lips. And number 3, the inner lips, are the thinner folds. These are the labia minora. That means the small inner lips. They meet near the clitoris at the front and they frame the opening of the rest of the vulva. Number 4, the bladder opening. Just below the clitoris, above the vaginal opening, is the urethra or the bladder opening. The small opening urine comes from. It's separate from the vagina. Number 5, the vaginal canal. So that is the entrance to the inside canal that we've already named. And 6, the skin bridge between the vaginal opening and the anus or back passage. It's a short stretch of skin that extends from the end of the vaginal opening to the anus. Knowing that area exists is important if you want to talk about soreness that's right at the back and not inside the canal. So that's a brief description of the whole outer map, not a mystery, just different parts with different names. Next time something feels off in your vulva or vaginal area, you can say, I've got an itch on my outer lip, or pain just close to the opening of the vagina. Or you might describe a lump near the front tip. That steers the conversation a whole lot better than something hurts or something itches down there. If you have a new lump and open sore that's not getting better, or unexpected bleeding, other symptoms that worry you, contact your GP or local sexual health service. This video is simply meant to educate you and not provide advice or treatment on specific medical issues. I've put together free vulval and vaginal health toolkits which can help you learn more about your body. Check out the QR code shown up on your screen or use the link in the description box below. If you found this map helpful, let me know in the comment section. Don't forget to subscribe and give this video a like. Next time, we'll be talking about what the vulva looks like when it's normal, from the color, appearance of the lips and hair, what normal differences usually look like. Drop your questions below and we might answer them in the next video.